Breast augmentation has become a highly popular procedure for women who want larger or proportioned breasts. Dr. Anil Punjabi of Redland Community Hospital tells us that this procedure is safe because of the implants currently being used.
We have used silicone implants, we have used saline implants, and over the last few years we are also using fat injections for breast augmentation. The placement of the implant can be done either above the muscle, which is below the breast tissue, so it is called subglandular, or it can be done below the muscle, and that is the pec muscle, the chest muscle, and that is known as submuscular. Over the last 20 years, the submuscular placement, that means it is placed below the muscle, has become more common, below the pectoralis muscle, which is the chest muscle. And the reason for that is because the chest muscle is active, it gently and passively massages the implant and keeps it soft and supple, because one of the problems with placement of implants is that they form scar tissue around them. And this scar tissue, if it begins to harden, it causes a problem called capsular contracture. By placing it below the muscle, it reduces the capsular contracture rate by about 5 to 7%. It also provides an additional layer of tissue to camouflage the implant so that it cannot be seen through persons who have very thin skin or very thin glandular tissue.
Dr. Punjabi talks about the different types of implants.
Initial implants that were introduced in the United States and most of the world were silicone implants. Silicone is a silicone gel. It is a oily synthetic material which is soft and it feels quite natural. The problem happened in the 80s that patients started complaining that silicone implants were causing them to have connective tissue disorders like lupus, rheumatoid arthritis, scleroderma. And the FDA put a moratorium on use of silicone implants in the United States. From 1991 to 2006, intense research was performed, and all those studies showed that silicone did not actually cause any of those connective tissue disorders. The silicone is locally irritating if it should leak. It causes inflammation in the breast tissue if it should leak, but it does not cause any systemic problems at all. So in 2006, the FDA released the use of silicone implants for cosmetic purposes. And the saline implants are also safe. The saline implants are filled with salt water. And the advantage of saline implant is, of course, the fact that if it should leak, it's just salt water, which is just absorbed by your body and you don't know the difference. And the other advantage is the fact that if it should leak or deflate, you know right away. Silicone implants are a little bit more difficult to detect if there is a leak because they are contained within the capsule and it sometimes requires an MRI to detect if it's leaking or not. The surgery is very safe. It takes about an hour and a half to 2 hours to do. It's an outpatient procedure. Most patients miss only about 3 to 5 to 7 days at the most of work, and they are back to the normal activity within a few weeks. It is a surgical procedure. Every surgery has its risks, but this is a very safe and it's a very comfortable procedure and very successful procedure for the patients.